Hello, everyone, and welcome to the very first edition of Ctrl+S. I'm your host, Karu Reina, and today's episode is called Don't Call Us Heroes. While we all have our own experiences of the current pandemic, there are some among us who have to face the ugliest side of COVID-19 every day. The average day at the office for a South African doctor, nurse, or porter includes isolation, fear, and death. And yet, like us, healthcare workers are only human. Human bodies can only take so much stress before we break down and burn out. Unlike the rest of us, however, the healthcare workers on the front line of this pandemic are risking their own lives and the lives of their families every single day they go to work. The level of daily trauma these doctors and nurses suffer is inconceivable. What happens when our healthcare workers burn out? Who will save us then? For this episode, I spoke to Dr Antoinette Miric, who heads up psychiatry at the Healthcare Workers Care Network. Welcome, Dr. Miric, and thank you for sharing your precious time with us today.
Thanks for chatting to me today.
Dr. Miric, what is the Healthcare Workers Care Network?
So it is it's a network which is actually it's a fascinating network which has been put together by the collaboration of many passionate people in different organizations. So back in February, March, when this pandemic started, and we were watching the news reports coming in from Italy and from China. I started looking at the literature and started wondering about my fellow healthcare workers. As a psychiatrist, I'm not specifically on the front line, and I got together a group of colleagues, very passionate colleagues, and about 14 of us in Gauteng, who set up the main content really. And ideas behind the Healthcare Workers Network. And we set up, we acknowledged that there was going to need to be a response for the healthcare workers involved in this. And then through many talks, we collaborated with SADC, South African Anxiety and Depression Group, SASA, which is South African Anesthetist Society, SAMA, South African Medical Association, and CISA. And together we have formed the Healthcare Workers Care Network. And that's what makes it quite strong, because there's a collaboration of psychologists, psychiatrists, anesthetists, specifically because they're on the front line a lot. So in terms of critical care. And then SAMA gives us the backing. And then we have the backing of CISA, which is the Psychological Association. So it was set up to educate the public and educate healthcare workers around the mental health effects of this pandemic, working in this pandemic. And that was the one aim. The second aim is to train up leaders and managers of healthcare staff. And we've been offering training to many different groups of people, nurses, doctors. We've probably trained over about 1,000 people so far, all online, but webinars. And that's the one big arm, and we're going to be running quite a few webinars soon. And the second arm is a more individual response. So any healthcare worker can access our 24-hour helpline, which is 0800 21 21 21, or they can SMS 43001. And the beauty of it is that there's a trained psychologist on the other side of that line who have all volunteered their time. And then healthcare workers can also fill in an online form where they get access to an individual psychologist or even psychiatrist who've offered 4 pro bono sessions per healthcare worker. So we've got 2 arms. We've got the education and prevention arm, and then we've got the response arm for specific healthcare workers who need it.
Do you think that the psychological trauma that our medical workers have to face every day is included in their training?
No, it's not included. I think no one has been prepared for this pandemic. And no one is prepared for the mental health consequences on healthcare workers. If you look back traditionally, the Healthcare Workers Care Network, we actually, or some of my colleagues started thinking about it last year. So even before the pandemic, we want this to be a continuous project. We've always known that mental health of our healthcare workers, frontline doctors, is a concern. It's a very, very hard audience to engage with. They are very reluctant to seek help. And no, I don't think they're prepared. I don't think any of us are prepared, even the public, for what the psychological impact of this is. And that is why we want to educate and explain what's going on and normalize a lot of this stuff.
One would think, though, that doctors and nurses have some kind of emotional resilience built into their profession. Just being in a hospital and dealing with the sick and comforting families, one would expect them to be a little bit more emotionally resilient than the average member of the public.
I think your point is valid. I think a lot of our healthcare workers have moved through the system, which has been challenging, as is, and they have developed, and just by nature of who they are, they have developed resilience. They've worked very hard, they've studied very hard, they've put in long hours. So in terms of a prepared workforce, I think we've got quite a strong prepared workforce. So it's not really about so much the resilience, the existing resilience of the healthcare workers. It's what is different about this pandemic. Why could this pandemic affect them more than any other thing? And there's a couple of reasons for that, which will erode that natural resilience. A couple of reasons is that this, is not temporary. It is going on for a long time. Because we were behind the curve in many countries, than many countries, there was a lot of good in terms of preparation, but it also resulted in a high amounts of anticipatory anxiety, the high levels of anxieties and stress and overwhelmedness before we even hit the peak. So what we were doing during that time is doing a lot of educating, and I think the people we did reach during that time, I think, have benefited. What we are seeing now is that many people are now reaching out for help, leaders, healthcare organizations, because now they're panicking and they're seeing the mental health effects. So I was an intern in 2001 during the HIV/AIDS pandemic or epidemic, and it's similar to this situation, but it's different. There, I remember the feelings of having to sit and write death certificates after death certificates and not being able to provide care for families because there were no ARVs. And that was incredibly hard as a young doctor. But what was different is it wasn't personal. I wasn't going home and then speaking to my relative who was also dying from HIV/AIDS. I didn't have HIV/AIDS myself. We knew how to protect ourselves, so bar a few needle stick injuries. We were not worried about contracting it at work. We were not worried about giving it to patients. We were not worried about giving it to family members. And that is the heightened level of stress on these already pretty resilient people, which then erodes the natural resilience. And I think it's natural. It's a natural occurrence. And I suppose what we're normalizing is that it's normal right now for healthcare workers to be really, really stressed.
One would think that their stress hormone levels are quite high. That must be affecting their bodies in the same way it affects everybody else's body. In a population that is medical workers, especially doctors, it seems that they're likely to brush off their physiological symptoms in favor of the task at hand. What kind of physiological danger are they in?
So I totally agree with you, and we're in what we call mid-phase of the pandemic, even in terms of mental health. We haven't yet reached, well, hopefully we're reaching peak phase, but we're in mid-phase in terms of healthcare workers. And they are in a state of heightened levels of adrenaline, heightened levels of stress hormones, cortisol. This they're not completely unused to. I'm sure a lot of them have been through it before. So if you think of me, I'm in my 40s compared to a new doctor in their 20s. They have not been through this before. I've been through this before. And I think older doctors who did go through that HIV/AIDS era, we've discussed this in our team, we think there might be a slightly better, or just an inbuilt knowledge of how to deal with this. Specifically, younger, junior, less experienced people are going to experience very, very high levels of stress because they feel out of control, and they are actually out of control. The truth is we were never in control, but this is just making it very, very obvious. So high levels of adrenaline, high levels of probably cortisol. I haven't seen research, but I'm sure there's high levels of cortisol. It is natural for healthcare workers to just push through at this stage. And it's not healthy, but it's natural. And I actually spoke to someone yesterday who asked a nurse how they're doing, and they said, doing fine, I'm just not thinking about it, I'm just working. Yeah. And it is a natural defense, which we're trying not to interfere with too much, because we do need a healthcare worker force. However, what we are encouraging is when those healthcare workers have any time off, they need to do certain things in order to just reboot. We're also encouraging those healthcare workers, while they're working on 100% drive, to take moments within the day to decrease those levels. So there are simple things that we think can protect a little bit.
What things are you recommending when they have a little downtime? And how likely do you think those healthcare workers are to do those things in that tiny space of given time?
Well, it really is up to them. But I do think they could find benefit from it. I know when I was a doctor, I built in things naturally without even thinking about it to kind of, we call it down-regulating the emotional system. Like I would walk the long way to the lab, just to take some extra time. So how likely they would do it is really up to them. But if they can understand that when they are literally, as I said, walking to a lab, or when they are, if they've got like 2 or 3 minutes break, if they're sitting watching a patient and not doing much else, they can do some breathing exercises, they can do some visualization exercises. They just need to know really what to do. Whatever makes sense for them. We've got some doctors who, when they have any kind of break, they put their headphones on and they have music on, while they're walking around. A lot of the junior doctors will be walking around a lot. So there are things they can bring into their routines. The other big thing is, because, we're all masked up and shielded up, and is what we are losing, just like the general public, we're losing that interpersonal connection. And that is one of the key things we're encouraging people to do, is still to talk, is still to connect.
Would you say that these kinds of stresses are different for different types of healthcare worker because they do different jobs? Do you feel that, for instance, their field of expertise enables them in different ways to deal with the stress?
So one thing on that, so directly answering your question, yes, there are different mental health effects we have seen by research, and we're predicting coming out of this. So specifically, as I mentioned before, the healthcare workers we are looking out for are the young female, specifically nurses.
Okay.
Specifically, young female single nurses who have children at home. So that's like a really specific group. But we're also looking across the field at younger doctors who may be asked to do things that they're not yet prepared for. None of us are prepared, but they're definitely not prepared. They may be running wards which are totally feel out of their capability. And then they're going to feel really, really guilty. And we can talk about that just now, about any outcomes. And the less experienced people and people being put to work in a scope, as I mentioned there, which is not their own. So like a nurse who's normally doing very admin work to move into a very clinical role, they are more likely to have mental health effects. So there are specific people within the healthcare worker staff who can be monitored. And I think that's going to be the most useful thing, is looking out for those at risk.
Would you characterize the current pandemic as like a wartime triage, like a field hospital on a battlefield?
I think certain phases of the pandemic, when the numbers are really high and the demand increases the resources, I think it does feel like that. And in fact, a lot of the research of how to cope with this pandemic is coming from the military research, which I think answers your question a bit. and look to our military psychiatry colleagues on how to cope with this, because we are considering it a trauma, and we are considering it a battle. I do struggle with some of the analogies as like heroes and calling them heroes. But in terms of facing new uncertain things, changing things, pressured, life or death decisions, yes, it is similar to being within a wartime field hospital. But it's not going to be like that all the time. It's going to be during the peak. And the systems, just from speaking to my colleagues, I think people are getting, you can't get used to it, but compared to kind of even a few weeks ago, I think even in Gauteng, some of the healthcare workers are getting a bit more used to it. It's a good sign in terms of healthcare delivery, because we need our healthcare workers. What we need to remember is that we need to remind them that this is what they're doing, and they are going to need ways to regroup afterwards. They're going to need to take leave. They're going to need to speak to counselors if they need to. We also need to remind them that the majority of humans, well-adjusted humans, I do believe in the research, from these wartime hospitals, shows that people do come out actually a little bit more resilient. And there's a concept called post-traumatic growth, which I'm starting to look at quite a bit. This is not discounting those specific groups of people who are going to struggle, who are at heightened risk for depression, PTSD, anxiety, substance abuse. And we have to be aware of both populations.
What are the stumbling blocks in their own minds to healthcare workers' mental well-being?
So the stumbling blocks would be time. I just don't have time to speak to anyone. And that's actually quite true at the moment. And we're getting quite a few requests for help, but they just actually don't even have time to make connections. So it's time. It's also stigma. There's a huge stigma in mental health in the public, but within healthcare workers, there's a very large stigma against receiving mental health.
That's quite surprising. One would expect medical workers to be hyper-aware of their physical well-being.
They might be aware that they're under stress, but the stigma of reaching out for help or asking for help or asking for support is a significant issue. I am hoping that it's better in the younger generation, because they've been around more discussions around mental health. But specifically my generation, there's a huge stigma against, receiving mental health treatment. So that's one of the biggest stumbling. The other thing is that people believe they're in control. I can do this. Of course I can do this. And yes, of course they can do it, but at what cost?
Yeah.
Even the most experienced people in the field are experiencing anxiety, stress, and trauma. Once again, this is normal. It's a normal reaction, basically. And it's, but it's about normalizing that within the healthcare workers' minds. They're not going crazy. They can't sleep. They're not, but so the major stumbling blocks are themselves.
It seems healthcare workers are less likely to seek psychological support. And it's pretty problematic that we're calling them heroes. We're referring to this as a war, and we're using all these soldier analogies. That must be quite isolating. It must contribute to that I can do this mentality. Our doctors and nurses wouldn't have time to work through their trauma in the same deep way that someone who's suffering from post-traumatic stress would. They're not quite at the PTSD stage yet. But if they don't seek help, there is a very high risk. So talk to me a bit about psychological first aid.
So I'm going to answer your question in 2 points. So one is the hero narrative. So if you're calling people heroes, you imagine like a person on a horse kind of galloping out to war. And they have got but they've got their armor on and they are going. And if they die, they die. But they are doing this for a cause. It is totally unfair to compare our healthcare workers to that. They are not meant to put their lives, literally their lives, on the line. So calling them the heroes sets up this expectation, like you said, that they should be just getting on with it and doing it. And they are, and we're talking to people who already have often like a type A, very controlling, perfectionistic personality. And they're going to be like, well, this is the way I have to be. And it results in them, they are seeing traumas. They are potentially not treating patients that they know could get help. They don't have oxygen, maybe. They are experiencing what we call moral injury all the time. Now, how does someone who's feeling guilt and shame within, but then being called a hero from external, how do they even think about reaching out for help? They don't, because they're like, well, I should be doing this, so therefore I'm not going to. And that's the biggest problem about putting the hero narrative. And in fact, if you look at our stuff, we're calling them brave and we're calling them courageous. We're not calling them heroes. So in terms of psychological first aid, psychological first aid is a type of therapeutic counseling intervention that was designed by the WHO, along with lots of different partners, in response to various traumatic events. So 9/11, hurricanes, and they looked at what was the most useful ways of responding. And it's not deep work at all, you're correct. Psychological first aid is a way of talking to people in a traumatic environment. And the training is actually available free at John Hopkins. There's an online training. You just don't get a certificate if you do it free. And it's a couple of hours. And I would advise anyone who's in this field to do it. And psychological first aid looks at supporting the healthcare worker in the here and now. So listening to what they're saying, connecting them with resources, and just treating them with compassion, human to human. So it doesn't have to be a therapist or a counselor. In fact, it wasn't designed for that. It was designed for public and lay people to help others. And it's a very, very important model, because we know from previous research that what's going to get healthcare workers through this is peer support, connection with others, and social support. And that does not need me as a psychiatrist to help.
It must be quite isolating, the physical distancing, the PPE, isolating from one's own feelings. It must feel like swimming through treacle just to reach out.
I think it does. And what we're finding is that when they're reaching out, they're in crisis mode.
How close are the healthcare workers to burnout by the time they reach out to you?
Yeah, I think they're burnt out. I think a lot of healthcare workers are burnt out. But they are reaching out in a crisis, which is exactly why we've set this up. Okay. But what we are trying to do through the webinars and training and education the public is explaining concepts of psychological first aid, and the importance of social support, the importance of reaching out to people who you know on the front line, even peer support. So frontline workers supporting each other. You know, some of you will have good days, some of you will have bad days. That is the preventative work. And yes, most of it is telephonic nowadays. But yes, the lack of contact, I think, is a big thing, because psychological first aid is often actually administered in the field. So if there's a big, earthquake, you have everyone in a tent and then you have counsellors, but it's face to face.
What makes our South African healthcare workers' stress and emotional concerns different to those of healthcare workers in other countries?
So I think I think that the healthcare worker stress and mental health effects I think they're global phenomenon. We do know that the stronger the leadership, the stronger the systems in the hospitals, the better they do. And within South Africa, we've got pockets of very, very strong leadership, very well-managed facilities, even in, initially the lack of PPE, the lack of uncertainty of guidance. So in terms of what South Africans healthcare workers are lacking, I think specifically in under-resourced areas, so such as the Eastern Cape. Yeah. are going to be under a lot more strain than more resource places. They're going to experience more deaths, more unnecessary deaths, and they know this. That being said, they've chosen to work in that environment. They know it's under-resourced, and they are going to do their best. I've got no doubt about it. But the more poorly resourced areas are going to struggle the most.
Considering their ease of access, is substance abuse a likely consequence of healthcare workers' present trauma?
So if we look at previous pandemics and previous traumas, the rate of substance abuse, looking at research 6 months, 1 year, 2 years down the line, is increased in those healthcare workers. So we are expecting an increase. In terms of access to, scheduled substances, it is always been an issue. Healthcare workers, specifically doctors, specifically certain groups of doctors, psychiatrists, anaesthetists, dentists, are at higher risk of substance abuse, even compared to the general public, but even compared to their peers. So if you take the day-to-day stress they're feeling, I don't even know if it's a post-COVID thing, it might be a current thing as well. They're needing something to quieten down their mind. One would hope that they don't get addicted to it right now, but there is a high risk. And in terms of alcohol, I think people, have stocked up. I do think it's still there.
Yeah.
But it's a real concern. But I think what we need to understand about substance abuse is why it happens, and it's because of underlying anxiety, depression, and trauma.
For those of us who have family or friends who are healthcare workers, what can we do to help? Do we recommend the Healthcare Workers Care Network helpline? What's the process?
So in terms of families and friends, I think it would be probably just making the healthcare workers in your life aware that, like, oh, look at this, sharing it on social media, sharing it on WhatsApps. I heard you were stressed, maybe phone these people, something like that along the lines.
Do hospitals have to sign up for your network services?
Hospitals don't need to sign up. Remembering that most hospitals, private and public, well, actually all hospitals, have employee wellness programs, have EAP programs, and we are encouraging them to use their own programs. But specifically for doctors, we know they don't reach out to those EAP programs. They often do look for private care, which is great, and they can get that. But in terms of access to private psychologists and psychiatrists, it's a waiting game, and you have to wait on lists, and it's quite difficult. So it's very useful for them to get immediate access to trained professionals to contact the Healthcare Workers Care Network. So what we are doing is we're engaging with different areas of government to make them aware. However, there's a lot of red tape in those processes for them to endorse anything. We are aiming to support existing EAP programs, knowing that there's a bit of a conflict of interest. We're offering pro bono services, they're getting paid for their services.
Yeah.
So they would be reluctant to, I suspect, to refer. Not all of them, but some would. And through word of mouth and through advertising and through SADC, we did a big launch and we got a really good response. We're still getting a good response. It's basically how can everyone else help? They can help us by promoting the network, making it known that it's aware, that people are aware of it. And we also have, so to run a helpline monthly is actually really expensive. It's not a free thing. We're paying for the software, we're paying for all the calls. And we have set up a fund, a Healthcare Workers Care Network fund.
Excellent.
And anyone can donate on our website. It is a SADC, it's a separate fund, but it's run by SADC, which means that people do get a tax benefit if they donate, specifically corporates. And we really had some really good engagements with some corporates who have already donated to allow us to start running what we can. We can't run the helpline without money. We can do the other services, but we can't run the specific helplines and projects.
Your website doesn't mention COVID-19 specifically in its name. Do you see the Healthcare Workers Care Network as an ongoing project?
It does require funding because all the volunteers, myself included, are running full-time practices. So in order to have someone doing marketing and project management, that needs funding and to take it forward. But yes, it's definitely something we are going to keep working on. I mean, we've got at least a 12-month sponsorship for the helpline, hopefully, and yeah, it must continue. And we've got really passionate people behind it. So I've got no doubt at all.
It's clear from my discussion with Dr. Miric that we should all recognize the humanity common to all of us. Doctors and nurses on the front line of COVID-19 are also just people with their own hopes, dreams, fears, families. Let's remember that even though our frontline workers are not heroes per se, these are the people who save our lives every day. If you know or are related to a healthcare worker, visit Johns Hopkins online and search Psychological First Aid. The course is completely free of charge, and it'll help you support the healthcare workers in your life. If they need more professional support, they can access the Healthcare Workers Care Network 24-hour helpline, 0800 21 21 21, or they can SMS 43001. There are trained psychologists on the other end of that line.